All right, I think we're live. Okay, good evening, everybody. It's Lucy McBride. It is, what the hell day of the week is it, Monica Gandhi? It's Wednesday. It's
Wednesday, 5 o'clock my time.
5 o'clock and it's 8 o'clock Eastern time. Okay, so here tonight, I'm joined with my friend, colleague, and wonderful, indefatigable Monica Gandhi, professor of medicine at UCSF and public health expert, infectious disease physician. She and I today put out a opinion piece in the Washington Post with our amazing co-authors, Tracy Hoeg and Alli Krug, about kids and schools. And we are arguing that it's time to really think hard about the harms of pandemic restrictions and weigh them against the harms of COVID-19 in kids. Monica, take it away. What are the main points that we're making?
You know, the main points that we made is essentially really starting out with the fact that adult vaccinations have decreased infections just in the last 4 weeks by 50% in children. And that's important. That happened in Israel, that happened in the UK. And then children themselves are not at risk for severe COVID like adults are. That's just an epidemiologic fact, which really changes our equation when we think about what are they at risk for. And then we put in the data, which I think is really tragic and hard to hear, about Colorado, for example, yesterday, the pediatric hospital declaring a state of emergency, a literal state of public health emergency because of mental health effects in children from all the restrictions we put on them over this last year, not just school closures, but restrictions. And then we said, okay, so we referred back to your excellent Atlantic piece that said, okay, let's take masks off children outside now. Keep on thinking, why haven't we done that? Just because it's been now weeks and weeks, well, where there's so much urging for the CDC to take away that summer camp guidance of outdoor masking. And then the final part, and I think this is very important, is we said, not only that, but fall time, when they go back to school, there should be no masking of children in schools, because 3 simple reasons. Vaccinated teachers are protected. Unvaccinated teachers, if they choose to be unvaccinated, have ways of protecting themselves, which are their own masking. And third, we haven't seen great data that masking of children, because they're already reduced transmitters, change the equation for teachers or for themselves. And obviously by that, we're going to have this amazing low cases and hospitalizations that we actually already have now in many places, like San Francisco and California. 3 hospitalizations, over 100,000 at the most is what we have here, likely lower. And then the final reason is it does inhibit learning to have little children masked. And there's a lot of data on that. So we're following the UK and taking the masks off children.
Absolutely. I mean, you know, as I was saying today on another program, there are harms of action and there are harms of inaction.
Yeah.
I make decisions every day in our personal lives as parents and for our own health. And then of course with patients,
yes,
about doing and not doing. So when I'm talking to a patient about a course of treatment for chemotherapy, for example, when they have a cancer that warrants chemotherapy, but they are having a hard time tolerating the chemotherapy because of debilitating side effects, you know, we weigh the risks of not proceeding with that medication, that chemotherapy, against the risks of the cancer not being treated as aggressively as otherwise might be. And what we do, case by case, person by person, is look at the person's unique medical vulnerabilities. We look at the facts and the data, at what these medicines can offer this patient, what this cancer would do if untreated or treated in a different way. And then arm the patient with facts and data and deliver nuanced guidance based on their situation. So now we zoom out to the United States of America, where everybody has unique risks. Everybody has unique risk tolerance, and everybody's entitled to those. You know, you can be an anxious person, you can be risk intolerant. And, you know, I do think the CDC, and I think Rochelle Walensky is in a difficult position because she's messaging to people who, on the one hand, don't believe COVID is real, and on the other hand, are cowering in fear despite having been vaccinated, wearing 2 masks and worrying about the 4th wave that's never happened.
Right,
so
right, extremes.
Yeah. Message to a very broad audience. At the same time, what you and I agree on, I believe, I'm pretty sure we agree on this, is that when you message with a fear-based posture and you message the sort of lowest common denominator of fear into the most afraid, most vulnerable person in our country, when the public health landscape is changing so fast and so positively, meaning hopefully in the right direction. And we look at the world stage and see countries like the UK ahead of us doing so well.
Right.
It's reasonable as we shift our guidance, for example, with my cancer patient when they are doing well or not well with chemotherapy, it's only reasonable then to shift the public health guidance as the public health landscape changes, because there are harms. You know, a lot of people say to me, my patients will say to me, my kid doesn't mind wearing a mask, or I'll wear a mask, for a long time. What's the big deal? Well, you may be the parent of a pandemic-proof child. You may not mind it, but there are so many people suffering silently and visibly behind closed doors, people who are not getting counted because they're in the ER for suicide ideation. They are isolated, they are lonely, they are traumatized, they are really suffering from depression and anxiety. And those things count. It's just they're harder to quantify in the decision-making rubric from a large public health standpoint.
I totally agree with you. And it hit me so much because we were in final proofs of this article, right? And literally at the end of the day, we added Colorado had just declared a pediatric mental health emergency, because that combined with some data that we had to cut from the article because there wasn't enough space about the suicide data, unfortunately, being released from California Department of Public Health in the last month. And children's suicide rate has increased, not adults in our state, but in the state I live in, there's been more suicides among young people. The risk versus benefit analysis has totally shifted after vaccinations, totally shifted. And I keep on thinking, why are we talking as if the vaccines didn't happen sometimes? The New York Times, you and I were discussing this past couple of days. I actually looked twice at the date on May 21st because the article was about masking, distancing, ventilation in schools. And I thought May 21st, 2021, things have so shifted. Those were absolutely, there was so much appropriate about the mitigation procedures before we had vaccines, but vaccines blow them all away. And so adult vaccination. And so it really amazed me that we're still, why aren't we moving with what's going on? And then now it's the time to holistically, like we do with our patients, putting back that hat of what's my risk versus benefit analysis. We did this calculation in the Washington Post paper where we multiplied the risk of your child getting sick.
How many zeros?
How many zeros did we have? I mean, actually, especially outdoor transmission, it actually would be good to look back. It was, I think, 4 zeros and then a 7%. And then you'd have to multiply it by 3 more, put 3 more zeros on it for outside transmission. It ends up being so low at this point in the United States, the risk of a child being sick. And actually, it's not like rural Mississippi is different from California, because the cases have been coming down precipitously in the United States everywhere. We're below 25,000 now. Likely I have a data analyst, and she thinks by June 15th we'll be at around 10,000. So it is really falling countrywide because we have natural immunity and then we have the vaccine, and putting those two together, we're getting a lot of immunity in our population. And like you said, we can see on the world stage that happened. They have so few cases in Israel right now that they actually made a decision to give 1 dose to 12 to 15-year-olds, not 2.
You're inspiring.
Right.
You're inspiring me because I'm looking at Vinay Prasad, and I'm looking at the fact that 12 to 15-year-olds are a generally very low risk for COVID-19. And did we need to issue an EUA? Okay, I'm just going to stop here and just say I'm the most pro-vaccine person.
I love vaccines. Yeah.
They are my BFF.
They are. I would hug a syringe of a vaccine.
Hug a vaccine, and
but no one has given that to me as a hugger. Yes, we love vaccines. So
that has to be said first. It's just like when you talk about unmasking, you have to say I'm pro-mask. I was masking before masking was cool. By the way.
Oh, and I want to mention I've written, much to some people's chagrin, written 7 papers on masking. So yeah, I was very pro-mask.
7 papers.
Until the reality comes in of post-vaccination.
Yeah, so there's nothing political about taking your mask off. It's purely science. So what I'm trying to say is that, did we need to rush an emergency use authorization on a vaccine for 12 to 15-year-olds when it's not technically, arguably, an emergency in 12 to 15-year-olds, I don't know, but I do know the reality of the world we live in is such that my daughter and your child, who's 13, I know, felt an immense relief from getting that first shot, because
Yes.
she, like every teenager, most teenagers, is like not immune to the fear and disruption to their lives. At the same time, I am now pondering, and I'm not going to go on the record about what I'm going to do because I'm thinking about it, just waiting for the second dose. A, because she's got great protection from dose 1. B, the risk to her is going down every single day indirectly as more and more shots go into American arms of adults.
Exactly.
C, it gives us more time to think about, safety, which I'm not particularly concerned about, but, why not think about safety? And then also a little more time to think about global equity, as you and I have been talking about. Do we really need second doses for these healthy youngsters when we could ship them over to India? I think there are a lot of reasons to pause on second dose, except for the realities of this country, where my daughter may not be able to go to camp or school without a second dose,
Yeah, I mean, one thing I do want to say is, today I was listening to the testimony in the Senate, and I thought, let's be super clear about facts. And it's always like you just said, we are doctors who see patients. So I'm always clear about facts. And so the fact is that children are less likely to transmit, and they're less likely, especially when younger, to get even symptomatic COVID. Actually, a good example is the Moderna trial for 12 to 17-year-olds was just released yesterday. And there were only 4 cases in those who got placebo, because children are so much less at risk for symptomatic COVID, that there are only 4 people with mild symptoms of COVID in the placebo arm. That does give it 100% efficacy, but let's call a spade a spade. There were hundreds of cases of COVID-19 on adults when this similar trials were being done in adults. So, it is just the truth, right? And so when I was thinking about the testimony today that we need to vaccinate all children because they're vectors, I believe in vaccines, and I'm likely to get I have a younger one than 12. He's going to get vaccinated eventually. But when the cases are so low because of adult vaccination, when for them to go back to school normally should not have been tied to their vaccine status, or even the social pressures that people will play with them or not, which in my case, they will play with them if they get vaccinated. I have younger kids than you. So it's this kind of social pressure, but where did that social pressure come from? This idea that kids, and this is the last line of our article, Lucy, and I meant a lot to me that we said, it's time to put children's needs first, when we just didn't do it for a year and 2 months.
Honestly, the sacrificial lambs of
Yeah.
there are a lot of sacrificial lambs in our country, right? I mean, there are vulnerable populations that have been affected disproportionately. But I do agree with you that children have been uniquely harmed by the pandemic when they are uniquely spared by COVID-19. Have kids die from COVID-19? Absolutely. I think it's about 400 children, and that's 400 pediatric deaths that should never have, that no one wants to have happen. It's just that when you put it in perspective of how many adult American lives we've lost, it's really small. And it's amazing, actually, that COVID-19 has spared kids. And so we need to allow them to benefit from our collective progress. Someone asked me today on social media, people have asked me all day long, well, I hear what you're saying, but what about my 11 and under? They're not going to get the vaccine for so long. And again, this person, and I was trying to explain it. I said, first of all, please read the article, because I think a lot of people comment on things and don't read the article first. No offense, but I do that sometimes. I just comment, and I have so.
Yeah, and I actually subscribed to Washington Post this year. I know, just to put in a plug for them, just because I think they've done great work.
They've done extraordinary work.
They've really, of all the nuance, that paper for me has been the one that's presented differently.
Yes, I totally agree. The Washington Post, hats off to them.
Yeah.
But I was just saying, so read the full article and look at the zeros. Look at the zeros before the 7, and that's the percentage chance that your child is going to get infected with COVID-19. And then think about what that is in comparison to other risks you undertake every day with your child, going to the swimming pool, driving
them to the
street, traveling on an airplane, going in a car. So I think we have I think you were asking earlier an excellent question. Why have we not pivoted? I think you and I both know I think it's human nature to get stuck in a fear-based way of thinking when we've been think back to 2020, March and April, when you're watching TV, you're looking at refrigerated body bags in the parking lots of emergency rooms in the hospital. You're watching people on ventilators. You're watching people die. We were terrified, and it was a terrifying time, and it still is a terrifying time.
And it's a terrifying time.
But we also can release ourselves from that fear. It's like the tiger in the wild has been caged, and now it's like a cat that's like, but not, the baby has rabies, but maybe not, but actually it turns out to be like a house cat, and we're treating it like it's a tiger.
Yeah, that's a great comparison. I mean, this is the funny thing is I'll get calls from reporters about what can I do and not do as a vaccinated, unvaccinated person. And I keep on thinking, put into the equation, what's going on in your community right now with case rates. And for example, in my community, my children, and I have one younger than 12, is protected like he was in 2019. Not because he's vaccinated, but because the cases are so low that he can't see COVID if he wanted to, right? And so I think now we should never discuss the word vaccination or unvaccination without the phrase, look at the case rates in the country, look at them plummet. Look at what Dr. Fauci said in the Washington Post the other day. We're going to get between control and elimination. I'm fine with control because as an infectious disease doctor, measles is controlled. And when's the last time you and the general public have thought about measles? I tend to think about measles a lot because I like infectious diseases, but you don't worry about it. And that's what control means, right?
Well, guess why I thought
so
about
rare.
Guess why I thought about measles a lot last year is because of people's anxiety reading about measles outbreaks. So everybody wants to get their antibodies tested. But it's an anxiety-driven thing. But that's a fair point. People want to get their antibodies tested from having MMR back in 1950. But I want to ask you about this. I was delighted to see a New York Times report today talking about the wide capacities of our immune system.
Yeah.
I was like, yay, New York Times.
Yeah, because I think you and I have been commenting not as much, I think, nuance coverage from that periodical as opposed to Washington Post, or I really feel that. So I was delighted to see
that they
something that complex and really, again, bringing down the fear by talking about the complexity and redundancy of our immune system. Yeah.
Yeah, because people think that, checking an antibody level is the end all be all of your immune system. It's not. That's one arm of your immune system. There are T cells, there are memory cells that go into retreat and hide and are at the ready to make antibodies should you be re-exposed to COVID-19. So this whole notion of we're going to need boosters in a year. I mean, didn't Fauci come out today? We don't need to say bad things about Fauci, but I think he said today that we need boosters, which
but he actually qualified it because I listened to that part too, and he said probably like in years. And so I think there has been a shift in the dialogue. Actually, what happened is on Monday there was this paper that I was talking to someone today, and it was like candy, like it was such an amazing paper, and it was in Nature, and it showed that those who had mild infection, if you actually biopsy their bone marrows, which is very nice people got their bone marrows biopsy,
and they're like, okay.
That this is what people do for research, but after mild infection, even you were forming memory B cells in your bone marrow. And the important thing about memory B cells, like you said, is they can last a lifetime. There's this paper from people who lived through the 1918 pandemic that their memory B cells were alive and well 90 years later. But the second most important thing, I really want to stress this, is people say, but the variants, maybe the memory B cells will produce antibodies that are going to work across an old strain. Actually, that's not how memory B cells work. They develop antibodies when they see a strain that's exactly designed for that particular variant. So those antibodies will be perfectly suited for B117 or B1351 or whatever you need. And then, of course, the T cell immunity arm, that's been known for a while. That's why I didn't end up being worried about the variants even from the beginning, because the T cell immunity was so strong against the variants that when that Qatar paper came out from the New England Journal, that they messaged at the CDC guidance on May 13th that showed us that vaccines worked perfectly against B117 and B1351 in Qatar by the time March came around and most of the virus was the variants, they worked beautifully. I wasn't surprised because of that complex T cell immunity. So this complexity of the immune system, never fear, will protect us. And one thing I want to say about that, there's also the story that goes around that immunocompromised people won't be protected.
Oh my gosh, really crazy, because I have many immunocompromised people.
Yeah.
You're an HIV doctor, and they're not protected.
Right. And in fact, I really find very unfair for the media to put in press words that millions of people will remain unprotected who are immunocompromised. Again, redundancy of the immune system. So antibodies, don't measure those because there's stuff that you can't measure, but your immune system is developing immunity to the vaccines in one arm of the immune system, even if one other arm is down. And if you need something measured, then talk to your doctor if we want to measure something more complex. But
that's right. I mean, at the end of the day, I mean, again, not to beat a dead horse on this, but nuance.
Yeah, nuance.
The headlines are really, really messing with people's minds. The headline that, you know, what was it, hundreds of thousands of Americans are not protected by, and you know, some woman sitting on a park bench looking forlorn. I mean, that is not serving the American public. No. There is so much more nuance. Taking an antibody is one side of your immune system. And again, like, are there people who have zero immune response to the vaccine? Probably not anybody has zero, but there are the people who have lower and less robust immune responses to the vaccine. Sure, but again, we need to understand.
As cases go down,
we need to trust our immunity.
Yeah, trust this. I mean, someone actually wrote something funny to me today on social media. They said, you know, we were saying real world data. You know how there was all these predictions, we'd have that fourth surge, like you just said. And someone said, I wrote something like, let's let real world data inform our predictions instead of closing schools based on predictions that weren't true. And someone wrote, let's let real world data on all we knew about immunity and pathogens inform why we suddenly acted like we didn't know what was going to happen with the immune system with this pathogen. Natural immunity happened.
Let's use decades and decades of understanding of the vast, wide power of our immune system, even if it's not 100% perfect in certain people. Yeah, so I'm telling my patients, you know, who are worried about the variants, you know, look, you can worry about what you want, that is on you. Everybody has different risk tolerances. But if I were you, like, I don't spend any time worrying about the variants. I have the luxury of having a normal immune system, but even if I didn't, I would not worry for 1 second about the variants. Or
that has been a
worry about your kids, how they're doing, ask them about, you know, their mood, how they're managing stress, you know, have an open-ended conversation with them. I would try to get back to your exercise routine, social life. Just don't worry. You know, anxiety loves the what ifs and the sort of the lack of certainty. But guess what? We're not, you know, we don't live in a world that's risk-free. That's just not on the menu. And so we have to get comfortable, as we have in the past, believe it or not, with uncertainty and with risk being everywhere. Because COVID's not going away. Yeah, it's just been, as you have said, defanged. It's been disarmed. And so it's time to really change the public health narrative and our internal narratives and start living our lives again and sort of reclaim our mental and physical health in tandem.
And I think the press can help us do that by really telling us about the effectiveness of the vaccines and how well things are going, instead of always something that bad could happen. I think that we could do that as physicians. In how we talk to our patients and also how we talk to the public. I think hopefully that people will take the time to read this Washington Post article, because we really put the risks in that perspective in this way that I really blew my mind when I saw our calculations about how low risk our children are in this country now from COVID after adult vaccination. And the other way to put that perspective into risk, and I know it's hard, but if you can put your toe in and spend a little time, like, you know, like you said, talking to your child, or maybe spending time with a friend, and the other population I'm worried about is our parents. My parents have been very isolated. So I keep on saying, will you go to dinner with your friends now that you're all mass vaccinated? And they did it for the first time on Saturday, and they were like, that was so fun.
That was so 2019.
Exactly.
So great. And it's healthy to reach our broad human needs, as you and I both know. It's important not to get sick with a virus, right? But it's also important to socialize, to connect, and when it's safe to do so, you should do that. You know, trying to prevent disease and prevent despair, it's not mutually exclusive. we can be safe and sane together. It's not either or. I think we need to talk more about and less about either ors. Do you know what I mean?
Yeah.
Like, we don't have to pick, oh, I'm going to either get COVID or I'm going to be, isolated and depressed. I mean, you can thread the needle here. You just need a guide.
Yeah.
You need to know who to trust, and you need to look beyond the headlines and figure out who's speaking the truth. We also need to.
They can trust us. The public can trust us.
I mean,
We're speaking the truth.
It's like, what are you talking about? I told my kids at dinner, I'm like, everything I say is just gospel. So like,
Yeah, everything we say.
Trust
But
me.
no, it's true. It's true. Actually, as physicians, there is never anything we've ever wanted is to not put people's in harm way.
And it's do no harm. I have no agenda. Like, all the writing I've been doing, all the speaking I've been doing, is not for anything other than to help people get through the day or get out of bed.
Yeah.
If you are busting your buns, Monica Gandhi.
You keep losing it away.
Well, the fact that, I don't know. Anyway, are you going on CNN tomorrow? I hope you are.
On Friday, actually, and that is on politics. And I think it's important because there's a lot about this that has
Just
anything
take it
to
away
do
from politics.
with
Yeah.
risk. It's politics. Yeah.
Yeah. So I was on Megyn Kelly's podcast yesterday, and she was saying how she's very low key about the virus. Has never been really worried about it, and why are we masking? And I was like, wait. So just to make sure, because I think she's talking to a largely conservative audience. I don't know, but I was masking before masking was cool.
Yeah. I wrote the first paper on universal masking in this country before it was cool.
You did. So when I'm saying don't mask outside, as my Atlantic article outlined, I'm not saying this is a political statement or this is about following the science. So we have to decouple the pandemic recommendations and medical advice from politics. It has nothing to do with that.
Yeah.
So I'm glad you're talking about that. I'm going to go on Morning Joe tomorrow.
Good.
And talk
about. Get up
about
early to do this, but it's important.
Yeah, it's actually not that. It's 7:40, so it's like the middle of the day.
Yeah. Please talk about our article. And
please join me.
Yeah.
Morning Joe.
Someday I will join you. Not tomorrow, but someday I will join you.
It would be early because
because it would be early my time. But yeah, I think this is tremendously important if we can give people I call it put back your risk benefit hat. When you think about that we used to always have with each other about thinking about, do I want to go to the gym or I don't? Because that's what the vaccines have done. They have taken away the pandemic for those who are vaccinated, and they are bringing down the cases so low for those who are unvaccinated that they become less and less at risk. And we are very lucky to have these vaccines.
Do you have 1 minute for me to ask you one last question?
Okay, yes.
So if you could do one thing sort of post-pandemic to sort of change a major kind of strut of society, this is a big question, but like what if you were in charge of like HHS or our public health or CDC, like what would you do like on day one? What would you do to like help restore trust in our institutions? Would it be like, what would you put? See, I would make it so that primary care was in the center of healthcare reform, and mental and physical health were addressed in tandem. We dispatched mental health to everybody in the U.S., unfettered access to primary care and mental health. So I just answered the question for you. What would you do?
That was a perfect idea about mental health.
We need to elevate primary care. People need a medical home, and they need a hub for problem solving. They need someone they can trust, where they can go for their depression and their dementia, for their fungus and their flu, and get their.
I think it's your point is, by the way, really good, because I'm a primary as well as an HIV doctor. But what I would do, and it really hit me this year, is I would realize that every culture from the beginning of mankind, the beginning of evolution, had always valued their children, had always put ahead of everything else, even evolutionarily, what the needs of children were. And what happened in this country, so much more so than the UK, than Europe, than India even, anywhere where they could, there was an emphasis on keeping schools open, because every pandemic response document that has happened since 1918 has talked about the importance of children and keeping in-person learning going, especially in the context of an illness like this, like you said, that it thankfully spares children. And I would put into context what we need now is mental health help in schools. We are going to need, when we reopen, mental health help. We're going to need unmasked children to be able to see each other's smiles, like we wrote in the article. It is important to see smiles. Facial expressions mean a lot to child development. And we need to now put funding into children's public education that addresses what happened this year and how we did not put children
Absolutely.
first.
I mean, I think we have a lot of, I think that's beautiful. And I think the COVID will quiet down and essentially be gone in important ways, but we are going to be dealing with PTSD.
Yeah.
I see every day in my adult patients the physical manifestations, emotional manifestations of childhood trauma all the time. If you ask enough questions, my friends teach me, I'm just trauma.
Yeah.
I mean, trauma can be losing your goldfish when you're 7. Trauma can also be, watching a loved one die in a pandemic. My point is, we all experience trauma. We all experience loss. We all have experienced some loss in the pandemic, and kids have experienced unique losses that in some kids will show up as adult medical illness because of PTSD. And so I agree with you. We need to invest in our kids. We should have invested in our kids in 2020 more.
Yeah.
And we should invest in their mental health now because they become adults and because it's the right thing to do.
And the final thing I want to say is that there is paper after paper. I would encourage people to look at this. I meant to tweet this after the 1918 pandemic, how much children ended up, because they had the time, having higher rates of cardiovascular disease when they grew up because they lived through the stress of the pandemic. Fetal stress in utero during the pandemic led to very poor outcomes in adults. We must address what happened in this country with children now.
Yeah, after 9/11, the incidence of cardiovascular illness just went way up. So we need to be, it's about preventative health maintenance. I mean, the cat's already out of the bag with trauma, but we need to really be on it. And Monica, I just can't thank you enough for joining me. I know you're a busy bee. I always love you, and I'm just honored to be in your presence. I would carry your shoes around if that's what you needed me to do.
I am honored to write this article, which I'm again asking people to please read, because I think it puts heart and soul into what we believe about children. Yeah.
Yep, we do. And have a good night.
Thank
Monica,
you.
I'll talk to you soon. Thanks for joining us. Bye.
Thank you. Bye.